Now, wait a minute, Dr. Drew.
Yeah.
Because now you get into some shit.
Okay. So, boy, man, you pack so much into your questions.
Because my name's not Keke.
Yeah, I'm guessing. And my name is Dr. Pinsky. I chose a different name, too, to go out in the world with.
It's like having compassion for somebody that's ready to kill you. Like, that's pretty intense. It's not called bestiality.
Oh, yeah, it is.
When you do women wrong, everything gets taken from you. Sharon.
Hello.
Okay, so this is what I wanted to talk to you about.
Uh-oh.
Now, people are always talking about women with daddy issues,
Okay.
men with mommy issues.
Right.
We're always talking about the effects that it can have on your relationship when you have mommy issues or daddy issues or whatever it is, your household, your parents were this, divorce, X, Y, and Z.
Right.
They always talk about how difficult it is for you to have a relationship.
Right.
No one ever talks about the difficulties it is to have a relationship when you grow up with parents that seem to have no issues. I'm serious.
Right.
Where your mom and dad been married for years, you got, they were cool, they were fun, you got a good relationship with them, even let's say one of your parents came from the hood, the other one didn't, and then it's like they reupholstered the hood vibe, and it's like they went from being hood to being chill.
Right.
It's like it makes you have a great, like this, I think, almost unrealistic idea of relationships, right?
Right.
Especially, like I'm saying, like, most, opposites attract.
Yeah.
It's like even with you and dad, you always talk about it.
Yeah.
You came from maybe like a little bit more of a crazier family.
Right.
His family was like really down, chill. They were all very, very close. You and your family maybe weren't that close, right?
Right.
So already that establishes the idea that, look, everybody don't come from the same kind of background. Don't judge them because you never know. But I think, again, me coming from that kind of background, where I hear all these fantastical stories, you're like, I grew up like this, it was hard like this. Then when I met your dad, he showed me what love was, and we fell in love, and everything was great, and we've been married for over 30 years, and he had my back, and I got his back, and we've been a team.
Yeah.
It sets the stage for this like fantastical idea of what it would be like.
Right.
Like, oh, I could find my person. And even if they don't come from the same background that I come from,
Right.
That's what it's about. I can introduce and show them love. And, I was talking about this. I've talked about it with a couple of my friends that come from the same kind of background that I come from, where their parents had this very happy love story ending. And it almost set them up for failure because actually, I don't think that is always like that. And I also do think a lot of times when you don't come from the same background as somebody, it actually don't work out.
Yeah.
And so I'm curious of what you had to say to that. Because again, everybody always thinks, oh, well, if this doesn't go this way, that person had mommy issues. Or that person has daddy issues. But no one ever mentions the reality that's actually you can come from a great home with great parents, and it actually ends up making you have an unrealistic expectation
I can
on
see
love.
that. Yeah, sure.
Because you think everything's going to be just chill and everybody's going to be nice like your mom and dad.
Right. Well, I came from a background. Let's just, first of all, let's talk about timing. I do think the generational, like my generation was totally different. You know what I mean? Like I said before, we dated the guys in our neighborhood. We dated the guys we went to school with, went to church with or whatever. Whereas your generation, you guys are dating people across the world. You know what I mean? So I do think that there is a compatibility issue,
I'm going to challenge you and say I actually don't think it matters if you have mommy issues, daddy issues, or perfect parents. Yeah. Dating is shit. Period. And trying to figure out what there is a issue in any way you see it.
Right.
Having parents that broke up, that were divorced, or that had a hard time getting along, or maybe you're not close to your dad, or maybe not close to your mom, sometimes actually can set you up to have realistic expectations in life.
I understand
it
what
can
you're
actually
saying.
make you say, well, you know what? Sometimes people who love you will disappoint you. And this is actually how you do create reasonable boundaries. I had to learn the hard way when my dad came back in my life. Or I had to learn the different way when me and my mom fell out. I think that sometimes that's actually a good thing. Even though it's harsh issues, I think because of me sometimes, I think I've been really naive. Because my dad is great, and my uncles are great. So misogyny came at me hard and quick with the quickness. I grew up in a house where my mom would say this is what need to be, and Larry be like, okay, Sharon, go ahead, Sharon.
Yeah, but
you know what I mean? So for me, when I entered outside of my household, and I saw that everybody doesn't really respect their wives or even women in the way that my dad respects my mom, it's a pretty rude awakening.
I understand exactly what you're saying. And the only thing I can do is speak to that from my perspective. And I just think that you just have to, I don't know, Larry and I, we had a lot in common. We both were twins. We both were the baby twin. His father died in a car accident when he was 11. My father died from cancer when I was 10.
But the way you guys view, I think it's important. This is a key piece here because, again, we have a lot of people that's listening that have been in relationships with people that they're like, oh, they didn't come from this, and I don't want to give up on them. Right. So what do you think the difference was? Because one of the main things you always said was, I was like, you would say, I wasn't like your dad. I didn't know love in the same way he knew it.
Right.
Mine's was, I talk shit about you and I cuss you out and tomorrow we cool.
Right.
So why do you think it is that you were able to fold into what dad ended up showing you to be healthy love?
Because I wanted to change. I think you have to want to change. I think you have to do a lot of self-reflecting. I mean, I did come from a house, not physical violence, but verbal abuse. We said very mean things to each other.
Well, that's just as impactful.
Yeah, no, without question. Yeah. My mother would say mean things. My father died when I was 10, so I don't really remember him being a mean person.
Sure, yeah.
I just really remember him being a mechanic. He fixed cars a lot. That's all that I really remember. But my mother, was a provider. She had her own business, so I learned independence from her.
Right.
But she also had a sharp tongue, and I learned that from her.
Yeah, it works when you need it.
Right, and we would what they call signify. Like we would say, oh, get out of my face, your breath stink, or we just said mean things to each other.
Come on, your breath stink.
Yeah, we would say crazy mean things to each other, and that just was our way of life.
Right.
And I think when I met your father, I was like 19 years old. They really loved each other. Mm-hmm. Like, they would not say a mean things to each other. And even if they had a disagreement, they would hug afterwards.
They sure do.
And I'd like, that's some corny shit. What's going on here? You were supposed to cuss him out and mean it. Like, what the hell? I got to show you guys how to cuss, And he would just say, I love my brother. I love my brother. I would never say that to him.
Yeah.
And I would just look at him like, okay. Because I just cussed my brother out.
We ain't talked for 5 months.
And we haven't talked for 5 months. And that was just normal.
Yeah.
That was normal to me to get mad at my brother or to get mad at my mother and not talk to them. And that was a form, now I see that was a form of abuse, verbal,
right. Well, you're
mental.
punishing.
Yeah, I'm punishing, very punishing.
Emotional punishment.
Exactly. Yeah. And so I think when I met your father, I wanted change. I didn't like that stressful lifestyle. I didn't like having to figure out, when
But you got to say back.
Yes,
all the time.
It's a game.
Is somebody going to hurt you? Can I tell them I'm happy because if something falls through, they're going to use it against me?
And it's a game. It becomes a game. It becomes just a ridiculous way of life. And Larry was just...
But it was a cycle that you had to personally break in order to let the new way of stuff in with dad, you'd say.
Right. It was deeply embedded. That's the thing. When you are raised in a home of abuse, no matter what kind of abuse it is, verbal abuse, mental abuse, mind games,
physical.
You learn those behaviors
to survive.
Exactly. And so basically when I met Larry, he was full of love and encouragement and all kinds of stuff. And then I just liked how that felt. And I remember one day we got into an argument and I just cussed. I said every cuss word. I mean, like anybody who knows me, I call myself a cussing Christian. And that just means that I cuss a lot, but I believe in God and I try to be a good person. But sometimes that's just who I am. And
You're a human being.
But I cussed my husband out. I mean, like I called him all kind of stupid, and I'll never forget this. He waited till the next day and he said, I love you, but I'm not going to let you talk to me that way. And if you want to be with me, you're going to have to talk to me the way I talk to you. And I mean it. I will be here for the kids, but I'm not here to be disrespected. And I thought about that. But I said, it's time to change. I never did it again.
Yeah, I think that's really so good, and I really love that you shared that, Mom, because I am a kind of person. I was raised by Dad. I was raised by you and Dad. I was raised under that love and raised under Christianity, which is the idea that all can be forgiven.
Right.
You know what I'm saying? And so I think in reality and in modern times, that is hard. It's hard to live by that, because when you do live through forgiveness and accepting people who they are and what they are and flaws and all, sometimes you are hurt.
Yes.
Sometimes you're ridiculed. Sometimes you're persecuted. Sometimes they attack you.
Yeah.
Because everybody's don't want to embrace love.
That's right.
And the more that they reject love, the more that they hate themselves.
Right.
And the harder it is for you to break through, because people don't want to forgive themselves.
You just really have to pay attention to people's actions, because we all can run a good game sometimes. All of us can be, use the gift of gab, but really just try to pay attention to what someone is doing. And that's what Larry did for me. He showed me he loved me. He was there. He worked with the kids. He could cook and wash clothes, and sometimes I would take a nap and I would wake up and dinner would be done.
Yes.
And you guys would be eating at the table, and
It kills me every time people are like, who's looking for Thanksgiving? Your mom throwing down for Thanksgiving? I'm like, no, my dad.
That's
I
right.
always really, again, I grew up in a home where gender roles were not a factor.
Right.
So that's also something I appreciate for you guys. But you know what? I gotta go. I love talking to you. But I'm very excited to get into a conversation with Dr. Drew.
Baby, this is Keke.
I'm so excited for our guest today, okay? Because I feel like I have a million questions I could ask him. I've been watching him since I was a teenager, and I'll promise to try not to go on too long. Not only is our guest a practicing doctor and expert on addiction, medicine, and mental health, but he's also a podcast host, author, and media personality. Please welcome to the show, Dr. Drew. Hey, Dr. Drew.
Hey, Keke. Thank you. It's such a pleasure to be here. It really is.
Oh my gosh, I'm so excited to talk to you. Like I said, I grew up watching you, and so I have tons of questions, from relationships to friendships to mental health awareness. I mean, just all this kind of stuff. So I'm going to dive right in with my first question, which is, I think around all of these mental health buzzwords, which I think are really good, right? Because they're kind of I don't want to say democratizing, but they're normalizing. How about that? Normalizing conversations around mental health. But in doing that, sometimes it nullifies the truth of what some of these words mean and some of the weight that they carry. So I want to call some out. Like, obviously we hear boundaries, gaslighting, narcissism. So I'm curious for you how you have seen conversations around mental health change over the course of your career, and kind of like how we properly use some of these terms.
Okay. These are actually huge questions. So let me get into it. I know, right? It's good. It's great questions. Let's get at it. So first of all, it's just so bizarre to me that someone that's worked, I worked in a psychiatric hospital for 30 years. And the idea that we treat conditions, illnesses that affect this organ, I'm pointing at my brain, differently then we treat that differently than something that's in our chest or in our guts or in our pancreas. It's just so bizarre to me. Yes, I understand that this organ in our skull is a special organ, and it's where we sort of experience this thing we call self, but it's also an organ that gets ill, has conditions. Absolutely. And they are no different than any other organ system that can affect us. And the fact that we treat it differently is freaking bizarre to me. So there's that. How people have changed over time. Gosh, there certainly, as you said, there've been greater acceptance. There's a lot of sort of an army of people that have been entering into the professions of mental health services, and our need for mental health services has gotten worse, certainly in this post-COVID days. And, these kinds of the world we live in right now, anxiety, depression is just everywhere. But people I think are better able to talk about it more freely. I mean, it's really important for people who are in the public eye to talk about their mental health issues much the way they would talk about any medical condition. Myself, I'm hypertensive, I've got prostate cancer, and I've had a major depressive episode, and I've got a generalized anxiety disorder. And guess what? I don't think about those things differently. They're just all things I have that I get to, part of it is more experiential, certainly on the anxiety side, but they're just all things about organ systems. Yeah?
Yes. I mean, so what is the difference between I'm having a mental health issue and I have a mental health condition? And I'm going to pull out narcissism, for instance, right? Everybody, in my opinion, has narcissistic tendencies. But what is the difference between somebody with a narcissistic tendency that's just maybe having a moment, or they're in a situation, and somebody that is, that has narcissistic disorder?
Right. These are all great questions. And really you can have mental health symptomatology that you find unpleasant, and you can want to make that better. And certainly there are treatments to make most things better. But when we talk about something being diagnosable, or SMI, serious mental illness, it has to affect functioning, and functioning in one of several areas. Work or school, finance, health, legal, relationships. You're having a major area of your life affected, and it's due to some brain thing. Then we're talking about a diagnosable or serious mental illness. Now, you said, I think everyone has some narcissism, which is true. There's something called primary narcissism that literally everybody has. But narcissistic traits is something actually kind of new, that I actually watched this happen in real time. So we've had a narcissistic turn in this country, and probably worldwide as well, where yes, indeed, most of us do have narcissistic traits. But narcissistic traits is quite different than narcissistic disorders, right? People get very confused. They think somehow that narcissism is an egotism or a self-preoccupation.
Right.
It can include those things, but it is not specifically that. Narcissism is really typically something we think of as caused by a narcissistic injury in childhood. Things like abandonment, neglect, or sort of inadequate getting our emotional needs met at critical periods of development. What that results in is that the primary affects that flow out of our body are the source of our feelings. Really, it's the autonomic nervous system. The vagus nerve is one of the primary sources of the information that gets to our brain that we understand as feelings. And if you don't have another human there sort of reflecting those feelings back to you, you don't actually develop a connection to those primary feelings, and they sort of drift off into the distance. And in fact, if something bad has happened to you in childhood, you won't trust that reflected emotion in other people. It requires vulnerability and trust to get into that frame that gives us the capacity to build emotional regulation and to make a robust connection with our primary affect states. And what happens when kids go through those experiences, they then have to look around the world and get from it what they need to feel better. And when you've had a narcissistic injury, you feel ashamed and injured and small and empty. And you look to the environment to feel safer, bigger, better. And you build what's called a pseudo self on top of those primary emotions that gets from what you need from the environment, which is often sort of a bigger sense of yourself that you need to keep fed from the environment in order to protect yourself against that vulnerable core. So inside, you feel empty, you feel ashamed, you feel little, but on top, your sort of conscious world and the self you show to the world is kind of big and bombastic and maybe actually could even be abusive. because you've sort of disconnected from your feelings, and you don't really care about other people's feelings either. You don't care about your own. You don't care about others.
And so the interesting thing to me about this is, like, I think if you're a compassionate person, right? If you're somebody, I mean, I think I don't want to say most people, but a lot of people would assume somebody that's a jerk really is just a deeply hurt person, right?
Yes.
But I think having that kind of attitude when it pertains to somebody that really has this disorder, it could be dangerous if I'm correct, because is the idea that a narcissistic person with a real disorder cannot change? Is that true when it comes to mental health issues like this?
It is thought to be the case that it is almost impossible to change true personality disorders. Now, I'm of the opinion that that's not true, but people will say that. I see people with narcissistic disorders change all the time when their life depends upon it. So in the setting of addiction, right?
I don't mean to laugh.
Well, in the setting of addiction, if they don't change, they're going to die. So they suddenly become more willing to do what they have to do to get out. They always have kind of narcissistic quality, but they can improve greatly.
Is it an awareness that happens? Like, what is the process of somebody with a personality disorder, whether it be a narcissism or borderline? How do you change that? Because it's not like a medicine you could take.
It's different things. I mean, borderlines can change in something called dialectical behavioral therapy. So borderline disorder is a slightly different narcissistic disorder where people have very unstable sense of themselves. Their emotions are extremely unregulated. They have unregulated hostility and rage. They use a particular emotional regulation style called projective identification, where they literally take disavowed feelings that they carry inside themselves, and they're able to inject them into people around them.
Oh, yeah.
They're able to make other people feel those feelings. And,
yes, it's actually quite powerful.
Oh man, it's uncanny the way they're able to do it. You're absolutely right, Keke. It's like a magic power they have. But as such, they're extremely tuned into other people's feelings, and they're very much about feelings.
Sounds like actors. No.
Well, they make good actors. They can make good actors and actresses. But borderlines suffer themselves because they really have difficulty in relationships, and all they want is to have closeness. But closeness is exceedingly threatening for them because they've been abandoned typically. So oftentimes abandonment is a major issue. But to get back to your question about can borderlines get better? Well, they can in something called dialectical behavioral therapy, DBT. They do tend to get, they remain borderline, but the way I've heard some psychiatrists talk about it, they say, well, the borderline stuff settles down. A lot of their
settles down.
Yeah,
because it's awareness. When I started learning about mental health, for me, I felt like I was in The Conjuring and like I was casting demons out of my life. Because when again, I can't speak to everyone, but I would imagine, and I know for me, when I started learning about anxiety, when I started learning about depression, I started to be able to say, well, hey, that's not me. That's that, right? That's this thing that I struggle with. So I'm not going to feed into it. So I would imagine that must be what psychiatrists mean when a person with a borderline personality disorder starts actually doing these works that start teaching them about themselves, then they know that they are actually in the controlling seat of what they choose to respond to, and they don't have to be so reactionary.
That's exactly right. That's their borderline stuff, so to speak, and that they can and they can do something with that.
But it's not the same with narcissism.
And narcissism, it's harder to get at those guys because their position is, what are you talking about? The problem's out there. You're the problem. Everything else is the problem. And when you refuse to look inside, and oftentimes it's too painful for them to look inside, they just can't.
Oh my gosh.
It's very difficult for them. I have great compassion. That's really so
sad to me.
It is sad.
I have great compassion too, but boy, have I experienced some terrible things because of it.
Yes, ma'am.
It's like, damn, it's like having compassion for somebody that's ready to kill you. Like, that's pretty intense.
That is really intense. And I'm not saying you have to because there's so many interesting aspects to what you're getting into here, which is like, for instance, what I can go in a room and have compassion for an alcoholic that just drove drunk and killed somebody. I can have deep compassion for them. However, my position is hey man, you should have come to me before. You're not responsible for this illness we call alcoholism, but you sure as hell are responsible for your recovery. And you waited too long and you killed someone. So now it's the law.
Now it's
up to the law. Now it's going to be a legal problem.
You're saying some really good stuff, especially and I'm so excited because this gets me into what I wanted to also talk to you about, which is you talk about abuse, right? Yeah. Abuse comes from many different things, but I think this is the problem when people find themselves in abusive dynamics is what you just said. I have compassion. I know where this is coming from. You know, you're not a terrible person. You're just dealing with this thing that makes you respond this way. But it's interesting because abuse, quote unquote, the action of abuse is seen the same way as narcissism, and it's also not really seen as a mental health issue, right? It's kind of like people don't deem an abusive person as somebody that's struggling with mental health issues, and yet are they? Because to hurt somebody and to go so far, something got to be wrong in your mind, right?
1,000%. That's absolutely true. And it can be a lot of different things that set that up, right? It can be addiction. It could be, with your own trauma you're acting out. It could be a lot of different things. But you're absolutely correct that so what you're getting at, I know you want to talk about boundaries, and this is a really interesting place to enter the conversation because when someone is in an abusive relationship, and they're the victim of the abuse, and they tell themselves, oh, but I know he's such a great guy. He's so sensitive inside. I have this special understanding that he was abused. That, I don't know if you are okay with
actually,
that is BS.
That is the wrong thing to do.
That is a boundary problem. You are not able to make a boundary between. I used to have this problem actually, not when I was not an abuser. I had this with patients where I had
the boundary problem.
Well, I would go into a patient's room and I go, oh my God, she was abused so bad. Oh, I have such a special. Oh, I'm gonna help her.
Too.
And you end up rescuing people, which is not what they need.
Yeah, they don't
rescue, and they don't need excuses, and they don't need you.
They need boundaries.
They need. They need
what they need, Drew. Help me. They need, Drew.
What you need as the person who's feeling these special feelings is understanding that has not a one damn thing to do with the person you're thinking about. Those are your feelings about your pain that is mobilized by that person's history.
Now wait a minute, Dr. Drew.
Yeah.
Because now you get into some shit.
Yeah.
Wait, you got to say that again.
Okay. It's important.
Oh my gosh, please repeat this.
So let me break it all down. So people, when they talk, you mentioned when your intro that people talk casually about psychological terminology, and they often don't really understand what they're talking about. Boundaries is absolutely one of those categories. People think about physical boundaries. Hey, I'm not going to let him into my space. Or boundaries in terms of behavior you will tolerate. I'm not going to tolerate that anymore. I will create consequences. That is the most superficial aspect of boundaries. Boundaries, what we're really talking about is boundaries around yourself internally, around your emotions. And if you're catching other people's emotions, or your pain and anxiety is mobilized by other people's emotions, you have a boundary problem. And
with yourself and your pain body.
In yourself. I had trouble. I vividly experienced this because I was dealing with a lot of abused people, and I didn't know this. I wasn't consciously aware of it till I went to therapy for 10 years to understand how much my boundaries were porous. But when I would be around people in pain, I would have deep compassion to the point where I didn't understand that my own early injuries were being mobilized, and my reaction to it would be, I've got to make that pain stop in that person. I got to help them, make them better. When in reality, what was going on psychologically is I needed the pain to stop so my pain stopped. And I was not aware of that. And that was not what the patients needed. What the patients need is you just being there and just being present without being infected by their pain and their feelings.
Okay, so I have two things here.
All right.
what do you do when you are a friend, a lover, a family member of that person, and they're not your patient, right? Because you just spoke from the spoke from the perspective of what the patient needs.
Yes.
But what does the friend need? What does the lover need? What does the mother, the father? What do they need, right? But I want to first catch the aspect of that where you were speaking to yourself, right? We want the pain to stop. So is the idea that this person is triggering it, or these people are triggering it, or is it that I'm finding people to trigger it because I need to bring attention to it? We going into it, ain't we?
Yeah. So let me do your second question first, which is what you're aiming at is what's called traumatic reenactment, which is one of the most bizarre things about the human being, which is when horrible things happen to us in childhood. This is what people don't talk about. That when let's say you have an abandoning, abusive father, he leaves when you're 5 years old. He was a drinker and he was sort of not so nice when he was around. The way the human brain works, for reasons we don't fully understand, is you will now be attracted to men like that. Not just because he was dad. You would think you would have the opposite reaction. Like, well, when I am romantically involved with somebody, I'm certainly not going to be with a guy that's going to leave me or drink. But the exact opposite happens with the human mind. The way the human brain works, you reenact. Freud used to call it traumatic repetition compulsion. And we call it today traumatic reenactments. That for some reason, and people don't frame it properly. The way you have to frame it is we become attracted to people and circumstances that are just like those in which we were originally traumatized. Now, why we do that, again,
that sounds so like a fly going into the light.
That's right.
Like,
it's so
ouch.
weird. Yeah, it's so weird. And of course, when you go and hang around people that are just like the abusers of the past, they do the same thing in the present because they're those kinds of people. And if you're one of the, if you're one of these people that always, are attracted to the wrong kind of person, it's you. You're a perfect instrument. And if you're attracted, if you feel lightning bolts for that person, it's going to be the same thing again, for sure. We always tell people, think butterflies, not lightning bolts, because if it's just somebody you're kind of attracted to, well, it may be somebody kind of like that, but it's not going to be the full-fledged reenactment again. So, if you have these patterns and you can't break them, that's the time for treatment. But to your point about whether you're bringing somebody in to sort of reenact these things, yes, we do that. And people with those reenactments do have terrible boundaries. That's part of the problem. But it's not necessarily the case. The fact is, like when I was back, not great with my boundaries, I couldn't tell that I was doing that. I didn't realize I was doing it. It was just I was looking at somebody with compassion, and I wanted to help them. That's what I was experiencing, and I did help them. I didn't hurt them, but I didn't help them in the way they needed, which was to just come up, to have somebody. Remember, I talked about that trusting relationship of being close to another human, and that's how we build our emotional landscape, is just having another person attune to us and reflect back to us. That's what, back to your first question about if somebody's not a patient, they're a family member, that is what they need. They need you to be fully present, not catching what they're feeling and not mobilizing your pain, but just being fully there with them, listening to them with your whole body, not just your ears, so you can be compassionate and you can feel what they're feeling. You can sense it, but not be overtaken by it. And to just, while they struggle with their own internal issues, so if you go in and go, I'm going to fix this for you, they're forever dependent on fixing. But you being present there while they struggle to come to their own growth, let's say, that's what they need.
But you said not taking it on, and I think that's really big. Not, and even in simplest terms, what you just said, stop trying to fix shit. You can't fix people's problems for them, and I think that's like a big one. Is like, just simply put, be there, be supportive, be nice, but be like, good luck. You know what I mean? You can figure it out. You can, you can make it happen for yourself, kind of vibe. You don't need to overextend to the point where you're now trying to like be their dependent.
But think about it. But think about, Keke, if it's my pain, how hard that is to do, to say good luck. You know what I mean? Because it's really, if I'm feeling it that way, it's like, ooh, I can't. I have to fix it. It's that kind of feeling.
So this is the thing this is that part of this that I really want to dig even deeper into.
Okay.
Is, it's hard to figure out, right? For me, for instance, right? I know where a lot of my pain has come from, right? In my life, I grew up. I wrote a whole book on it. I grew up, in Illinois, in poverty, beautiful family. We had a lot of different, different toxicities that are generational, from anxiety to depression, all economically enforced, right? I mean, we're Black American. We have a history of oppression on top of dreams deferred, mental, physical, all these different things that we already know in the world that are pretty systemic. Here I was. Oh, wow. Everybody in my family, if I dance, I can bring joy in this moment where everybody seems sad, right? That was a sense of survival and bringing love and joy into the world, right? I learned to overextend myself to try and settle some of the debris around us. That is just like not my fault, right? As time goes on, it becomes a thing that moves my family, not just out of poverty, but like into wealth and into popularity and et cetera. And then that changes the dynamics of my family. And that brings on a whole nother set of issues, because here I am being 12 years old, being the financial breadwinner of a household where, patriarchy says women shouldn't be doing that good, and damn sure not no kid, female. So then that's its own thing, right? And then there's all these different dynamics with my parents. They're afraid. They're trying to maintain. They're trying to keep me as a kid, but they don't understand my personal boundaries. So now I feel, like I have this responsibility. I'm this, I'm that. Years of therapy, right? Always have been in therapy since I was about 17.
That's amazing.
And so there's that awareness there, right?
Yep.
But even with that awareness, I guess the question I'm asking is, what is the concept of healing and being healed and not being affected? Because I feel like those wounds are closed.
Yeah. Okay.
But yet you still have this concept of reenactment. What is that?
Okay. So, boy, man, you pack so much into your questions. It's good. It's so good. But
I see you over there making notes. He's like, okay, wait a minute. I love this.
So, all right. So you were the hero. You were the rescuer for the whole family, right? And not only were you the hero and the rescuer, you were a parentalized child, which is very difficult for children when they become the sort of the parentalized unit. They're taking care of everybody. That's traumatic in itself, right? And then did you put yourself in therapy at 17? That's wonderful.
I did.
That's amazing.
I did.
Amazing.
I was like, I can't handle it anymore.
Yeah, amazing. And so that's why you understand these things, and that's why you understand you can't take care of other people. That impulse to do so is sort of diminished. In terms of, when am I well? You're asking, when, how do you know you're better? And I know, I think when the simplest way to describe it is that it doesn't bother. Some of the things are still all there, but they don't bother you. Now, the problem with saying that is the way the human brain deals with trauma gives you the sense that it doesn't bother you anymore. So when somebody brings up, how does it feel that dad left when you were 8 or whatever, you go, oh, I don't think about it anymore. It doesn't bother me anymore. Well, the way what your brain has actually done is taken a piece of yourself and walled it off. It's deeply injured and it's so off in the distance. Yeah. And so therapy sometimes gives you access to that little piece of yourself that needs attention. It just can't get it because it's not wired into the rest of your system anymore.
Exactly.
And the only way and if you're having traumatic reenactment, that's a sign that it's still there and operating.
It's still there. Damn.
Still there. So the way to go at that is to go, well, hey, your anxiety was treated, your depression was treated, but this trauma piece maybe is still left behind. And there are highly specialized treatments for that, things like EMDR and trauma therapy.
What is EMDR?
EMDR, eye movement desensitization therapies, and it's sort of, they're kind of close to hypnosis, but not specific. They're not that. You're not really in a hypnotic state, but it's a way of getting your brain to give you access to those areas in a tolerable way, so it can start to regulate with the rest of your system. It's the really highly neurological stuff that what's going on in our brains with all of this. But I think there's probably a little piece of you left behind somewhere And
I remember. I actually remember, Dr. Drew, the moment that it happened, because it was like you said, it was no one could relate to me, not my siblings and not even my parents. And it was also, it could get, anytime a dynamic is shifted like that, it could get highly toxic because no one knows how to deal with the trauma of being a celebrity or having a celebrity child, and then dealing with, my parents did great. You know what I mean? I said this in my book, like I can judge all day and night, but I'm pretty good. I could have been worse off. But the reality is I remember at that time as a child when I did not have the awareness and the understandings and the words and the knowledge that I have now, I just said, I'm never coming out again. And at that point, it was just like, I choose happiness and I choose joy, and I don't choose to go back there. And like you said, as time goes on, I'm like, I'm good, whatever that was, I'm good.
Yeah.
But then I reached that reenactment, and the reenactment is, here it is again, someone doesn't see me.
Oh, interesting. Isn't that interesting?
Here it is again. I put myself in in an intimate scenario with someone where they don't see me like they didn't see me.
There it is. There it is. So that's very powerful. You're talking about leaving a piece of yourself behind. Okay. I can relate to that not being seen or not being heard as being extremely, frankly, infuriating. That's sort of the feeling I have with that, but I suspect in your case, you also feel pain. When
infuriating and debilitating.
Yeah. And so that's back to why am I attracted to people and circumstances that oblige me that way, And
here I am as an entertainer. No one ever sees them truly.
Yeah, well, that's a whole other thing, right? That's another thing. You asked about narcissism at the very beginning, and I talked a little bit about that pseudo self. I deal with a lot of celebrities over the years, and the one thing I have found is they rarely put their real selves out in the world, and they typically don't even use their real name. They always come up with a name that they put out there. It's really interesting, isn't it?
Yes, because my name's not Keke.
Yeah, I'm guessing. And my name is Dr. Pinsky. I chose a different name too to go out in the world with. Now I had a real specific reason for it, but I'm sure everybody else does too. And so it's very interesting. And so one of the things we do when we treat celebrity, first thing we do is start calling them by their actual name. Jennifer or whatever, and some people it's deeply touching because to be called by who you really are,
Sometimes it is touching to me, and sometimes I feel defensive to it. Like, what do you think you know?
Oh, interesting, right? So this is that thing, whatever that is, which is it, at its core, it kind of feels like a fear of abandonment, right? It's kind of an abandonment feeling. It's not really abandonment, but it has that quality to it. And so,
yes, I love that word. Yeah, it has that quality to it. Yeah, that's right. It's like it's in between abandonment and something else.
Yeah, it is, right? And it's a very special thing because it's your unique circumstance and experience, having been parentalized, having been in the public. This is a unique thing that you've been struggling with. And it's going to have unique sort of consequences, I'm sure. And it's got to be hard for you then by the same token. This is why EMDR may be so useful for you. It's hard for you to have somebody sit there and go, I know what you're talking about, because nobody really does. Right? And then you just feel unseen again. Right?
Baby, this is Keke Palmer, yeah.
You also said something really good that I feel like is also a topic of discussion on the internet, which is the assumed understanding of the personalities of the people that want to be in front of the camera, or the assumed personalities and drive for people that happen to be wealthy. And so I'm interested for you, right? Like when there is this kind of like modern attitude of eat the rich, right? Everybody wasn't born rich, but a lot of people, especially through internet, have grown through popularity, have been able to make a living for themselves. And then the tide changes, and the concept is because you're are wealthy, because you are someone that's in front of the camera, you're automatically a narcissist. What is that from a societal standpoint? Because we know mean people in every tax bracket. We know selfish people in every tax bracket.
Yes.
Why is that the assumption of anyone that is in front of the camera, that they've got to be the bad guy because they're the one with the power? I mean, is that really true? Do you feel like 9 times out of 10 that's true?
No, Keke, look, when people are thinking about other people as all good or all bad, we're into a terrible place. And especially when you think to yourself, well, I'm good and they're bad. That is narcissistic thinking. That in itself is split. It's a split. That fact is, everybody has good and bad qualities, and most of us mostly good. Most people are mostly good. They are. And to then say because somebody is a certain political party or somebody's a certain socioeconomic status, they are bad. That is your brain is doing that to you. That is not an okay way to think about other people. That is a problem in and of itself. Then the other thing, and this is really the bigger problem, which is you look at every religious literature you could name, scripture, any scripture, and certainly the Judeo-Christian scripture is replete with injunctions and warnings about envy. Envy is a destructive emotion, okay? And by envy, I don't mean jealousy. Jealousy is, oh, Keke's in front of the camera, she's doing well financially. I don't like it that she has that, but I'm going to work hard and I'm going to do something like that too. But I don't like that she does that. Envy is, Keke's got that. It makes me uncomfortable. I have to destroy her. Yes. That's envy. Envy is it's the most destructive of human emotions.
That's
right. So if you are thinking to yourself that you need to destroy somebody because they're bad, that is envy, and that is dangerous. That is dangerous.
Oh, I love that you broke that down. And before I let you go, I want you to break, if you can break, you give me so many jewels and so many keys. I mean, I just live for you. You know, I want to ask you this last question to leave our people with, because I see this a lot on Reddit, because even I Google it a lot of times. So I think a lot of people have this question, and the question is, am I the bad one? Oh. And what I mean by that is, we're all in different dynamics with friends, family, lovers, and you find yourself saying, well, damn, I'm playing the game on myself and I'm actually the person that's doing wrong, and is there so how does someone know if they're, and look, it takes two to tango, right? But how does someone know when they did the wrong thing and they're really the issue? How do you know when you're the issue?
Keke, the person who is reevaluating themselves, trying to do what's right, contemplating they could be doing what's wrong, that is rarely the person who's doing wrong. It's the person who has irrational certitude about that fact that they're always right or their position is the right one. That is irrational. Rational uncertainty is a healthy position for people to be in. And we still could be the one who's wrong. We could be. But we are constantly open to evaluating ourselves and make it a practice. I think there's two so simple things I've really landed on recently, Keke, that you could do. Really simple things that help everybody not be the bad guy. A golden rule. It's been around for thousands of years for a reason. Treat people the way you'd like to be treated. You're not likely to be the bad guy. It's pretty simple. Pretty simple. Number 2. Behave in all circumstances like there's a camera running. They're going to be played back at any time, and people could evaluate it, your behavior and your choices. And God, these days the camera is always running practically.
And exactly, and everybody ready to record you.
Yeah, and so you better be careful. But be that as it may, just behave as though you could look at the film and evaluate it and say, okay, I'm okay with the choices I made. Those two things, you're going to be fine.
I love that. I love that so much. And I know my listeners feel the same. Before I got to let you go, we're going to play a quick game. We love our games here, okay? It's called Questions That Need to Be Answered. And I know this is going to be too good with you. Now, in this segment, I will ask you burning questions that I know have been on everyone's mind. And you have no choice but to give me an honest answer. Are you ready?
Okay. Oh, boy. Here we go.
Okay. Out of all the shows you've done, what's the craziest thing you've witnessed?
Adam and I used to get this question all the time, and so we just we eventually ended up picking one call that was pretty wild. was this guy that called in and he said, you guys are open and non-judgmental, so tell me why everyone always gets so upset when I tell them about my monogamous loving relationship with my partner. And we're like, what? And he goes, well, who's your partner? Well, it was an Akita Collie mix, a dog, and he was not only having sex with this dog, he had trained the dog to have sex with him. And that was not, I mean, that's a hard thing to listen to. So, but he taught me, I was fascinated by the guy. No, because I interviewed him for a while after. I'm like, what is this? And he taught me about this. There's a world of zoophiliacs out there, and they have.
What's that?
It's people that love animals, really love them, and they don't. What I found in
it's not called bestiality.
Oh yeah, it is. It's not okay. There's nothing okay about any piece of it. Trust me, this is not okay. But I discovered that a lot of the people that were in that little community were people that had been severely neglected in childhood, like left for months at a time. And they didn't have a kind of connection with humans that was like right. They couldn't connect with people really, and connecting with animals was like no different than connecting with humans for them. It was very odd. It's a very odd thing. Now I don't know if that's universally
here I go.
true.
I go. Oh my goodness! I gotta help
fix that. I'm so sorry. No, stop doing that with the dog. Stop it, man.
Exactly. Okay, what's the number one thing you miss most from Loveline?
You know what I miss? We had a little Camelot moment, particularly when we were doing the MTV show, and it was me and Diane Farr and Adam, and we had lots of really cool guests, and there was like a couple of seasons there we were just in a role, and it was just such a cohesive community. I just missed that time and those people that were part of that community. That's what I miss.
It's always good with like that. That's like, when I've done movies or shows or whatever, when you're, there for days on end and months together, it becomes your family. So
and sometimes there's sort of there's something very special about the people and the relationships. And then this is what I did. I was a doctor all day. I didn't know what happens. I just thought, hey, we'd be together forever, like all my relationships.
Yes.
And all of a sudden, poof, everybody's gone. That's it.
But that's what I was just going to ask. Funny you said that. Are you still close with Adam Carolla? How do you feel about all the things that he's been accomplishing?
Yeah, I'm at his studio right now. This is where I'm talking to you from. I couldn't get away. I had to do something with him this morning, and had to run right in this room to do this. That's his poster behind me.
I love that so much. Okay, now this is less of a question, more of a request, and obviously you can deny, but could you sing a little opera for us?
Okay. By the way, since the Masked Singer, I found out I've got all kinds of vocal cord problems. Have you done that yet? You need to do that show. Maybe I'm calling something out. Okay.
I haven't done it, but I've been told, I'm like, I do need to go on there.
Yeah. It's one of the best produced shows on television. It's so fun. But here we go. Let me think. So, Vanne la tua metà giovedo, I spinge il tuo dimone, e tuo limon son io. I can't do it without
Oh my gosh, that is so cool. I live for the opera. Opera is just so dramatic. Yes, because it's so dramatic.
Oh my goodness. You're rare. Most people don't get it. It's very dramatic. It's crazy dramatic. But the music, my God, the music. I sit. It's so exciting. Go listen to the end, the last scene in Pagliacci sometime. Just listen to it all the way to the end. There's no way you're not crying by the end.
Yeah, I mean, it's insane what people can do with their voice. People can really evoke emotion. Good. Okay, last question. As a father who does what you do, are there any traditional, or I should say actually controversial or non-traditional parenting things that your approach, especially for me as a new mom?
Two things. One is one is excessively lax, and one is excessively rigid. So think about what that does to my kids. One was I told them when they were like 14. I said, "Look, I'm a zero." I just believe adolescents have to get clear messages. You can't say you can do this here, but not there. Adolescent brains can't handle that. So I was very clear. Look, no, I don't allow you to do anything illegal. That includes drugs and alcohol. Nothing illegal. I don't magically say, oh, you can do this illegal thing into my house. No, nothing illegal. And let me assure you, if another parent has a party where illegal things are going on and they serve you beer, trust me, I'm going to show up with the sheriffs and I'm going to be standing on the lawn laughing my ass off when they haul off those parents. Just suffice it to say, my kids didn't get invited to many parties, and so, but it doesn't prevent anything either, right? My daughter's 2 years into sobriety now, and so I just wanted them to get through adolescence safely, and I've seen too many catastrophes in adolescence, so that's one thing. On the lax side, I let them watch Beavis and Butthead in South Park when they were like in the 6th grade and all the way through. So I don't know. It's a little schizophrenic.
I mean, that's kind of how my parents actually were. And it's funny because I have a Virgo mom and you are a Virgo, I just realized. And I'm a Virgo. And Virgos are like that. It's like Virgos are like, and then also kind of like, oh, that's not a big harmful thing. And so I get that. And by the way, Dr. Drew, I'm not going to say your age on here because I don't know if you care about that, but I know your age. And
good.
The fact that you're 65 is nuts. I don't know what the hell you've been drinking and doing, Dr. Drew.
I know.
But
I feel lucky.
It's kind of insane because you do not even almost look 60.
I know.
Or 50 even. I mean, damn, you look good, man.
Keke, I appreciate that. You have no idea. I'm coming back tomorrow to do your show again. But I've exercised, I think resistance training is a very important thing. I've lifted weights and worked out my whole life. I've watched my diet most of the time. And, I take supplements that I think are making a difference and sort of anti-inflammatory antioxidants and stuff. And I don't have great genes, like I told you at the beginning.
You out here putting good karma out there. That's that good karma, Dr. Drew. You out here saving lives.
I've been with this, my wife since I was 24 years old, and we're I'm just as into her today as I was when I first became. And
that's why your hair's still on their head. You know what I'm saying? They say that on the memes. They say when you do women wrong, everything get taken from you.
I'm going to play this part for my wife. So because people go, how do you after 40 years? How do you guys? Because we are into each other. And I said, it's kind of like recovery. It's one day at a time. It's weird if you're as into that person today as you are, you're probably going to be into them tomorrow. It builds on itself. And
what sign is she?
Capricorn, I think. Whatever goes with Virgo, it goes pretty well.
That's a perfect match. Yeah, that's Virgo and Capricorn. Well, that's a blessed union, and I appreciate you so much for coming on the show. And 1,000%, you're coming back to the show, and the next time is going to be in person because we've got a lot to unwrap with me.
Oh yeah, man, for real. We'll do a series, you and I, Keke. That's it.
Yes,
I see it.
Dude, you are my guy. I've been watching you since I was a kid. My sister's going to just freak out that I'm talking to you, Dr. Drew. So thank you for everything you've done, and I'll talk to you soon.
Keke, thank you. Thank you for the great questions. Thank you for taking care of yourself and representing mental health so positively. Let's do more of this. I can't wait.
This conversation has given me a lot to think about, and I hope you enjoyed it as much as I did. I have some psychoanalysis I have to get to, but don't fret. I'll be back soon. Until we meet again, you know it's your girl.
Baby, this is Keke.